Rational Wellness Podcasters. Dr. Ben Weitz here. I'm so glad you could join me today for another episode of the Rational Wellness Podcast. Each week, I'll be bringing you the latest cutting-edge information on health and nutrition. In this media-driven world, it's easy to be confused about what's true and what's not. I'll cut through the conflicting headlines to bring you clarity, to help you optimize your health and maximize your life. Please subscribe to the Rational Wellness Podcast on iTunes, Stitcher, or YouTube. None of the information in this podcast is intended to diagnose any condition, and this podcast is not intended to substitute for going to see your medical doctor and getting sound medical advice. So let's get started on your path to better health.
You think just finding its way and we are.
Welcome, Rational Wellness Podcasters. Our topic for today is autoimmune diseases. And I know autoimmune diseases sounds technical and not very sexy, but autoimmune diseases are really becoming increasingly common causes of sickness and death in the United States. Autoimmune diseases have been on the rise for at least the last 4 decades. The immune system is designed to protect us from bacteria and viruses and parasites and to repair our tissue from damages. Autoimmune diseases are diseases where the immune system, instead of protecting us from threats outside, the immune system gets rewired and starts attacking our own cells and organs. The immune system, therefore, is out of balance. And there are approximately between 80 and 100 different autoimmune diseases, and at least 40 other diseases that are suspected to have an autoimmune basis. According to Dr. Thomas O'Brien, a noted expert on autoimmune diseases, if we include diseases that have an autoimmune basis, autoimmune diseases are now the 3rd leading cause of death in the United States, since most of these diseases are chronic and often life-threatening. Some of the more common autoimmune diseases include rheumatoid arthritis, lupus, psoriasis, celiac disease, Crohn's disease, Hashimoto's hypothyroid, multiple sclerosis, and type 1 diabetes. Conventional medical doctors treat autoimmune diseases by controlling the symptoms, such as providing thyroid hormone in the case of Hashimoto's thyroiditis, or by using medications that suppress the immune system, such as corticosteroids or chemotherapy agents, or the newer injectable TNF-alpha blocking agents like Humira and Remicade. These drugs simply block the immune system, but this is a problem because you need a properly functioning immune system. And therefore, these drugs have very serious side effects like infections and cancer. But a functional medicine approach treats autoimmune diseases by looking at some of the underlying factors that lead to the immune system getting dysregulated, such as leaky gut, food sensitivities, toxins, including mold and heavy metals like mercury, infections, nutritional deficiencies, etc. And this is very important. If I have a patient with Hashimoto's thyroiditis, hypothyroid, and most women in the US who have hypothyroid actually have this autoimmune Hashimoto's, and all this patient is treated with is with thyroid medication, as typically happens. It may control their symptoms, but it doesn't do anything for the smoldering fire of the autoimmune disease that has been attacking the thyroid gland. And chances are that over time, this will continue, and the patient may end up needing higher dosage of thyroid medication, or they may end up with another autoimmune disease, because studies show that patients who have one autoimmune disease are at much higher risk of contracting another one. So not just regulating the thyroid with thyroid medication, but putting out the smoldering underlying fire of autoimmunity is crucial for this patient's long-term health. To get some clarity on this topic of autoimmune diseases and what to do about them, I'd like to introduce Dr. Arland Hill, a doctor of chiropractic practicing in Webster, Texas. Dr. Hill is a seasoned functional medical clinician with 15 years experience. And Dr. Hill has an interesting background. He grew up on a farm, and this instilled in him a love of the importance of food and the way that food affects our health. Dr. Hill enjoys discussing how the effects of a degenerating food supply, as our modern food supply is, the effects that this has on increasing chronic diseases like autoimmune diseases and what to do to prevent them. Dr. Hill is an author and has produced a platform, foodfunctionfreedom.com, that enables Dr. Hill to share accurate health information to the public. Dr. Hill, thanks so much for joining me today.
Hey, thank you so much for having me.
Excellent. And so what do you think what are some of the primary reasons why there has been an increase in the rate of autoimmune diseases in the United States?
Well, I think we can probably just, on the surface, narrow that down to two things. One is that we're being exposed to far more things than we ever have been in the past. We've got, whether it's variations of what we now classify as food that 50, 100 years ago, we wouldn't have thought about these things as being truly food. And then also looking at the number of chemicals and various toxins that we find in the environment now that also we didn't see prior to the 1940s. There's been a major increase in the number of chemicals introduced into the environment since that time, and that are continue to be used on a persistent basis every day. So I think that's right at the top of the list. And then right along with that, I would consider stress. And when I say stress, I'm going to be a little more specific in this, because stress is a very kind of a passé term, just that people don't put a lot of emphasis on it. But the reality is that if you look at the effects of stress, regardless of how you define that, that breaks the body systems down. And as it relates to GI health, or as it relates to autoimmune and immune health, it's going to create dysregulation in the immune system, and it's also going to open up the gastrointestinal tract for opportunity for autoimmune conditions to be able to manifest. So it creates that, what many people have heard about as a leaky gut. It begins to open the door for that scenario.
Great. I know you've written about what are known as the triad of factors that increases a person's risk of autoimmune diseases. You just mentioned leaky gut. There's also some genetic factors, and then we have environmental factors. Can you explain a little more about the leaky gut and how it is that disruptions with our gut barrier increase our risk of autoimmune diseases?
Yeah, absolutely. The triad that you mentioned there, that was something that I came across back doing some journal reading back in 2014. And it was really an eye-opening paradigm for me, because it pretty much laid out exactly how autoimmune diseases manifest themselves and what the core criteria are. And as you alluded to, one of these core criteria is going to be, as it was labeled then, it's called gut dysbiosis, but it basically is just suggesting that there is an imbalance of organisms in the gastrointestinal tract that opens the door for a leaky gut or an increased permeability. Now, just to further explain that, this leaky gut and what we're really talking about is the GI tract. It is more of a gatekeeper system, if you will. So we have the ability to differentiate between what we want to allow to cross over that barrier and then what we want to keep outside of that barrier, or really inside the GI tract and be excreted out. And what begins to happen with this leaky gut scenario is that we begin to break down and breach that barrier system. We lose this gatekeeper responsibility, and the gatekeeper is to some degree allowing things to move through that shouldn't otherwise be there. Things that are very notorious for causing this to occur, and I'll just give you a couple of them here. I did mention the stress, but it's really stress from the standpoint of increased utilization of nutrients to handle the stress that then don't allow those nutrients to be available for the health of the gastrointestinal tract. Your chemicals are very common in this. Medications, appropriately prescribed medications, many times are notorious for doing this, depending on the class of medication. And then one that is more in line with that triad, the gut dysbiosis, really meaning an imbalance of organisms. So whether we're thinking about this as simply as good versus bad, even though it's not that simple to when you really start looking at it. But we're really talking about organisms, bacteria, parasites, fungus, viruses that create some degree of disruption that breaks down that barrier system as well.
Great. And so if a patient has this disruption in their GI tract, an imbalance, a leaky gut, what are some of the best strategies for trying to correct this?
Well, there's two that you have to go back and look at with this that are core to the process. Number one is trying to identify what are some of the causative agents, really looking at and investigating what spurred this whole process to begin to move forward in the first place. And then once being able to identify that, remove that element, and then also coming back in with nutritional and dietary interventions to help provide stability to that environment on a long-term basis. And I really like this strategy because rather than saying, well, as an example, let's take glutamine to improve the health of the GI tract. Glutamine is very beneficial for the GI tract. Matter of fact, it's one of my go-tos very often.
Right.
But the problem is that you can't solely rely on glutamine to correct that environment as long as there's still some type of, for example, again, a bacteria or a fungus, one of these types of organisms still present. So we need to remove the problem. Right. And again, that could be a food element that we're talking about, a food toxin that we're talking about could be creating that disruption as well. So we want to remove the problem, and then additionally, we want to go back and give the body back what it needs through either food or direct nutritional repletion to address restoring that environment.
Right. You're alluding to the 4R or the 5R program, which is remove, replace, reinoculate, and repair.
Right, and I will share with you on this, Doug, we've actually gone past that ideology now. Not that the concept of the original 4R is any less relevant, because it's equally as relevant now as it was the first day it was ever talked about. But now we know that there's other factors that we have to take into consideration too. So for example, we have to go in and reestablish what's called mucosal tolerance. So basically looking at the ability of the immune system to recognize when there truly is a problem that it should respond to versus when it should not. We have to replete the deficiencies that are taking place. One of the core underpinnings of a leaky gut is that there's going to be some degree of nutritional deficiency associated with that. And we want to rebalance the landscape. We want to change the landscape of the GI tract to make it a more hospitable environment for the bacteria in the gut, for what we often think about as our probiotics.
Right, great. We've been talking a little bit about the gut and the importance of restoring the gut and removing the factors that affect the gut, and then trying to put in some of the repair factors and try to get a healthy gut. What are some of the environmental factors that play a role in the onset of autoimmune diseases?
Yeah, I think when we get to this part of the conversation, if we don't really start right at food, we're probably doing anyone listening to this truly a disservice, because food, and this is what I share with patients, food's a maker or a breaker. There really is no in-between when it comes to food. You're either consuming food that is rebuilding and restoring your health, or you're consuming food that is contributing to your demise. And when it comes to the component of contributing to your demise, you really have to start with looking at what gets added into our food, even at the point that it is still out in the field in the growing phases, if you will, and even at times before that. And we're going to be talking about things here like the most common ones are going to be things such as glyphosate. Many people will recognize glyphosate in their home improvement stores as Roundup, as a weed killer that they use around their homes and on their lawns. But this is also something that gets applied to crops as a whole as well. In addition to that, you're going to have another one named atrazine. Atrazine is very commonly used in corn production. And when we think about how many different components or how many different areas we can actually find corn in the food supply, it's pretty prevalent in the food supply. And even more so beyond that, we have to think about, well, what else gets fed corn? And that's going to be, for example, cattle, poultry, and believe this or not, even fish. So if someone is consuming a farm-raised fish, right, that is going to be another source of introduction of some of these chemicals into the food supply. So a lot of times we think about hearing things like grass-fed and pasture-raised and wild-caught, and we think, well, wow, is that really that important to consume those things? And it truly is, because otherwise, if you don't, what you're eating are foods that are contaminated with these chemicals as a result of the foods that they were consuming.
Yeah, absolutely. You point out the importance of not consuming farm fish, and I really can't emphasize that enough. Not only the corn, but other toxins, and they actually have to, like the salmon. If salmon are not eating their natural diet of plankton, their skin is not even pink, so they have to give dyes to. So companies that are farming salmon have to put dye into the food to dye their skin pink, and most of those are chemicals. And then when some of the salmon die, they chop them up and feed them back to the salmon, so you can get a higher concentration of all these toxins. So farm fish is really something we need to try to avoid.
Well, and to your point about this, so again, going back to the whole topic of our conversation today being autoimmunity, those dyes, those, in addition to those chemicals, those are all triggers for the autoimmune response. So they're foreign substances. So they're not elements that are going to be easily incorporated into a metabolic pathway in any form or fashion. So the immune system identifies these as foreign entities and begins to develop a response against these.
Right. I've read some of your articles where you've also mentioned that some of these toxins become triggers that actually sensitize the system to become more sensitive to foods and other things than otherwise. So there's sort of a acceleration effect with all these toxins.
Yeah, that's exactly right. And you bring up this point about cross-reactivity there to some degree with this. And this is a very common occurrence. And probably the best scenario I can give the listeners for on this is going to be when we talk about gluten. And gluten, most people know about a gluten-free diet. But what we can also have is that components of gluten, even when someone has gluten completely out of their diet, there are certain fungal strains, certain candida strains that can actually, because of some of the proteins that they express, they can actually mimic gluten. So someone may truly have gluten out of their diet, but if they still have these infections present, then those are going to be enough of a mimicker that the immune system doesn't differentiate between the two, and it treats the fungus just like it would the candida, or I'm sorry, just like it would the gluten.
Interesting. So somebody who has a sensitivity to gluten and is trying to stay on a strict gluten-free diet, because they may have exposure to molds or some of these other toxins, may still be triggering the same response.
That's exactly right. And the immune system will, you can actually continue to, this is something I observe more frequently than one might imagine, is checking for the gluten-related markers, and those gluten-related markers are still elevated, and the patient's scratching their head thinking, I'm following a gluten-free diet, I'm doing what I've been asked to do regarding gluten-free, and I'm still reacting, and oftentimes they've got some type of infection there, many times a fungus that is contributing to that reaction, or that's actually the core of where that reaction is coming from.
Interesting. So these gluten markers, are you referring to like the Cyrex array 3 and 4 panels?
Yeah, so definitely looking at those, looking at the antibodies, the IgG, the IgA antibodies. One of the other things that I do with this, I do a lot of stool testing in my practice because, again, treating autoimmune patients, I need to be able to look and see exactly what the dynamics in the gastrointestinal tract are. And one of the markers that I get on this test is what's known as an anti-gliadin IgA. So I'm directly looking for the antibody in the gastrointestinal tract to confirm that that individual is having an immune response to gluten or to something that's mimicking gluten locally at that environment.
Oh, okay. Interesting. We could keep talking about any one of these specific topics forever, but I want to move around to a few other things. So we've been talking about some of the toxins, and maybe you could talk about some of the other toxins besides a couple that you've mentioned. I know heavy metals sometimes are problems, and mercury, lead, etc. And then how do we test for these toxins as well?
Yeah, so some of the other ones that are out there, and I'll try to stay with the more prevalent ones, the ones that are going to be more applicable to the population at large. Plastics are another huge one. Many people recognize this as BPA. Yes. And one of the things that I'll share with you and share with the viewers on this is that BPA, even though you don't want to consume things that have BPA in them, keep in mind that if you're still consuming things that are out of plastic, you're still running some risk of exposure to a foreign or to a toxin, to that particular compound breaking down. So even though it says BPA, that's good, but it doesn't put you 100% in the clear. These are going to be, again, found in plastic. You'll find them in linings of cans if you're using anything canned in terms of food preparation or as a food source. Cans are often lined with BPA. So that's certainly a big one. So I always recommend they're trying to consume liquids out of either glass or stainless steel.
Right. Let me just throw one more interesting thought there too, is with BPA. BPA is on a lot of these shiny cash register receipts. So like at my office, we go out of our way to get BPA-free paper. And only recently I learned that even though the paper is not coated with BPA because it starts with recycled paper to begin with, and some of the paper that goes into that recycling has BPA. Even the BPA-free paper has BPA.
Yeah. So, and to your point on this, it just your example just truly illustrates how prevalent these things are in the environment and how difficult it can be to get away from them at times. I mean, they are just used far more than most people would think that they're being utilized. So that's certainly a big one. And then, as you also alluded to, heavy metals, these are still prevalent as well. And when it comes to heavy metals are a little bit tricky because there's many ways that they can create problems. They can actually insert themselves into metabolic pathways and disrupt the pathway in place of an essential nutrient. So for example, let's say mercury displacing selenium or lead displacing calcium, that type of scenario. Or what they can also do is that they can bind to a protein somewhere in the body. And now what you've got is a protein with that metal attached to it, and the combination of those two doesn't look like normal tissue any longer, and the immune system begins to develop a response against that. So those by far are probably the most common ones: the chemicals in the food supply, the plastics that we're so frequently exposed to, and the metals in the environment.
Interesting. How do you test for some of these? How do you test? Do you test for BPA, or you just sort of assume that people have it? How about heavy metals? Do you do any of the chelation challenge testing, or do you test for these in your practice?
Yeah, so what I like to do with this is with the autoimmune patient, I'm really interested in what the immune response is. Has the immune system identified that particular substance as a problem, and has it begun to develop a response against it? So what I'm looking for is a lymphocyte response, and the lymphocytes are going to be the group of cells that are going to develop a more adapted, a more delayed type of response, but more of a sustained response as well. So these are the ones that really begin to progress the autoimmune state. So oftentimes I'll use a test called an ELISA-ACT test. So I can see multiple different aspects, whether it's a food that's a problem, whether it's an environmental toxicant, if you will, whether we're looking at potentially some type of organism, for example, a mold that could be a problem. It allows me to look at a lot of different factors at one time. The other thing that I will do, especially if I'm concerned based on a patient's history that there's some type of chemical exposure, is I'll do a burden challenge, especially if I'm dealing with a patient who's a long-standing autoimmune patient. Oftentimes I'll do a toxic chemical burden challenge and have them catch a urine sample and see how much of an individual toxicant they're actually excreting and trying to process through the kidneys, which would be an example of what's built up in the tissues.
So is an example of that like a heavy metal oral chelation product that they take, like DMSA, and then capture their urine? Is that the type of thing you're talking about?
Well, see, now this is interesting because now what we're talking about are different type of toxicants, and we have to treat those differently. So, for example, if we're looking at like a heavy metal, chelation is a great way of addressing that, because now we're going and we're utilizing substances that are going to go in and directly bind to that heavy metal and try to extract that heavy metal out. And whether we apply that to the testing or to the treatment side, we really like to apply those chelation agents because they really enhance the clearance process of these various toxins. Now, if we switch the conversation to more of chemicals, chemicals are a little more tricky because they can be a little more residual in the tissues. One of the things that they like to do by virtue of their structure, they're fatty type structures by nature. Most chemicals are. And as a result of that, they're going to find their way into the fatty tissues of our body. So it takes a little more time and effort often to clear these out. And one of the things that's extremely beneficial, and other than just optimizing what are considered phase 2 or phase 1 and phase 2 detox pathways, or what most individuals would just think about as their liver detox systems, is utilizing polyphenols. And people will think about polyphenols as being the colorful part of the diet. When you look in the fruits and vegetables, all that color translates into polyphenols. And one of the things that we recognize about polyphenols now is they have the ability to bind to these various chemical toxins and help them be excreted out of the body.
Interesting. I guess there's other chelating agents too that are sometimes used, things like clays and chlorella and
yeah, your cysteine, lipoic acid, things like that. There's a pretty good plethora of these that are out there.
And then, of course, the other strategy is to upregulate the glutathione by using NAC or maybe taking some form of glutathione.
Yeah, and that's actually one of the reasons that I like those polyphenols also, is because polyphenols, that colorful part of the plant, those are also going to be extremely beneficial in enhancing that glutathione. And glutathione, as you alluded to there, has some chelation ability, it has some binding ability as well. And it keeps the inflammatory process down, because as we can appreciate, when you've got a foreign substance in the body, there's going to be a secondary inflammatory response that comes along with that. And many times that's one of the underlying contributions to the symptoms that someone may be experiencing. So if we can decrease that inflammation with those polyphenols, as well as get the binding effect to help pull and remove some of these toxins, now we're getting more bang for the buck. We're getting two effects from one intervention.
Cool. So would you say the best way to increase the polyphenols is it basically just include different colored fruits and vegetables, or is it also helpful to add like a green and maybe a red powder drink, or do you want to take specific polyphenols like resveratrol, et cetera, et cetera?
Well, I think we would be doing a disservice if we didn't say to start with food, because again, at the end of the day, it just begins with food. So we have to incorporate those in. But for someone who's already in a toxic state, many times what can realistically be consumed through the diet alone often is not going to be enough.
Right.
There's certainly, a fortifying, whether it's, for example, a smoothie or some type of protein shake with the reds and the greens, always a great approach to take with that. And I even like to start to bring in some of the individual polyphenols as well. One that many people are going to be familiar with is curcumin or turmeric. That is a very potent polyphenol, has great capacity to decrease the inflammatory response, but also to help clear out some of these toxins. Some of my favorites in this category: curcumin, quercetin, green tea, what we call the catechins in green tea, that very active component there, resveratrol, which many people will associate with an anti-aging effect, and thinking about the food source of it being grapes or red wine is often where they've heard about something like that. But those are very efficient as polyphenols in terms of their effects. And especially, going back to the core of what our conversation is around today, when we talk about autoimmunity and that regulatory effect to the immune system, these are all compounds that have been very, very heavily researched, and the efficacy of them in autoimmune scenarios is probably best stated as more than well proven at this point.
That's great. I'd like to cover two more topics quickly. One is the role of infections in autoimmune diseases, and how do these play a role in triggering or increasing our risk?
Yeah, and when I think about infections, there's probably three areas that you have to think about and differentiate on this, if you will. The first is going to be the gastrointestinal tract. And again, I start here because this is one of the core criteria for the autoimmune triad, if you will. So I always make sure that we're assessing that environment. The second area that we want to look at is going to be the sinus cavities. So if someone, and also I should link in that the mouth. So any of the upper respiratory region that we're talking about there, that could be another storehouse for an infection to be present. And then the last category we want to term as stealth infections or viruses. These are, and they're not all stealth infections are not viruses, but a lot of them can be viruses. But these are going to be things that may not always clearly show up. There's a little bit of investigative work that has to be done beyond what can sometimes be seen just on the surface. But these are important because these can be persistent irritants to the immune system, and they can continue to promote that state of dysregulation.
Interesting. Yeah. I recently was listening to a podcast by Dr. Aviva Ram, and she was talking about Epstein-Barr virus playing a role in triggering Hashimoto's and certain other autoimmune diseases.
Yeah, and just interesting you bring up Hashimoto's because there's just been several organisms that have been linked to this. So, for example, you've got one called Yersinia. Lyme disease has been linked to Hashimoto's. We've got hepatitis, Clostridium species. I mean, there's a lot of species out there that have been directly linked to Hashimoto's. So we know that these organisms play a role in the progression of autoimmunity.
Interesting. So, from a functional medicine perspective, you have a patient with hypothyroid. Just giving thyroid medication is just only scratching the surface of the disease process.
It really is, and I know this was something you had alluded to in the introduction. I mean, what you're really doing is you may support the patient in symptomatically feeling better, and you may increase that number of or that amount of thyroid hormone, but there's really nothing in that process by giving that medication that's tackling the autoimmunity itself, because in reality, the problem is not a thyroid problem directly, it's an immune problem. And if we take our eye off of that, we're missing the forest for the trees, if you will.
Right, great. And the last topic is, what role do nutritional deficiencies play in autoimmune diseases, or your likelihood of contracting one? Or
Yeah, I mean, it's certainly in likelihood of developing an autoimmune condition, because there's a couple of things that can take place here. And let me go back to that triad, if you will. So if I look at genetics or nutrition plays a role with genetics. And when we look at a process called methylation and how we replicate DNA and how that DNA responds to the environment, there are direct nutritional cues that influence that interaction between our genes and the environment. So it's directly linked into our genes. When we think about these environmental factors become more of a challenge when we've got a dysregulated immune system. The immune system becomes more likely to respond to environmental substances. And what we see is that there are certain nutrients that keep that under control. For example, vitamin D, our omega-3s, glutathione, these are very core nutrients that are going to help balance that response to the environmental triggers out. And then when we look at the state of the gastrointestinal tract, whether we're looking at the infections or whether we're talking about an inflammatory response that we would classify as a leaky gut or permeable intestines, you have to literally think about a large array of nutrients. All of our B vitamins become relevant in this conversation. Glutamine, I alluded to a little bit earlier. For example, vitamin A and zinc are necessary to restore and replicate and rebuild the environment of the gastrointestinal tract. So it becomes very difficult to effectively manage an autoimmune scenario when there are prevalent nutrient deficiencies around.
Interesting. So this sounds like, this is a very complex, complicated topic, but I heard Dr. Sidney Baker a while ago basically sum up the way you can look at health and disease is, what do you have too much of? Toxins, infections, heavy metals, etc. And let's reduce those. And what do you not have enough of? Nutrients like polyphenols and vitamin D and omega-3, and get more of those. And, sort of a simple formula for promoting health.
I love it. And that's really, I have a diagram that I show my patients, and it's truly those 2 points. It's what does your body need and what's interfering with your body from becoming optimal health or reaching optimal health again. And it truly does narrow down to those 2 things.
That's great, Dr. Hill. Thank you so much for joining us. I would like to mention one thing, and then I'd like you to give how people can get in touch with you, either doctors or patients. I'd just like to mention that we may have criticized the conventional medical approach to how to treat some of these conditions, but I firmly believe, and I think that you probably do as well, is that most patients would be best served with having a good, conscientious, conventional medical doctor, and also having a functional medical functional medicine practitioner like yourself or me or some of the other great functional doctors out there, and that neither one takes the place of the other. And for any of the patients who are listening here, none of the information we're giving should replace going to see your medical doctor and conferring with him or her as well.
Yeah, I would absolutely agree with that. And this is really the core concept of integration. It's not one side or the other. It's really how can the two align to best support the patient. And I will tell you from my own personal experiences, I have seen patients that are far enough progressed along that they do need some of the conventional therapies just to begin to try to gain some sense of just to get it under control enough to where we can start to be more effective, and then we can try to manage the core issues. But sometimes those symptoms are just so advanced that if some of those conventional therapies aren't employed, the patient's going to continue to suffer. So it really is a truly integrative mindset that we need to approach this with.
Excellent, Dr. Hill. So for patients and doctors who'd like to get a hold of you, what's the best way for them to contact you or get more information about you and your services?
Right. So the best way to get information is going to be to go to my website, which is drarlandhill.com. And that's just drarlandhill.com.
Excellent, Dr. Hill. Thank you so much. And hope to talk to you in the future.
Absolutely. Thank you for having me again.
Okay.